Older people's safety, well-being and trust in their provider is at the heart of aged care. Registered aged care providers and workers are responsible for managing risks, meeting obligations and delivering safe, quality care. The Aged Care Quality and Safety Commission is responsible for regulating funded aged care services to support the well-being and rights of older people. The Commission uses provider supervision to make sure providers and aged care workers are managing risks and delivering the best possible care. Together we protect older people and maintain trust in funded aged care. So how does provider supervision work and what does it mean for you and your organisation? Let's find out. Provider supervision has 4 levels. Let's break them down. Risk surveillance is the baseline supervision status. This is where most providers stay. It means you show low risk and have no major compliance issues. We monitor and assess your service and do routine compliance checks, but we don't take extra regulatory action. If you have strong systems and are proactive about safety, you're likely to stay at this supervision status. Targeted supervision is when you have a risk, harm or compliance issue that you need to fix. A Commission case manager helps you understand your responsibilities and what you need to change. If you're at this supervision status, we believe you can and will fix the issues and stop them from happening again. Active supervision is when you have widespread or high levels of risk and you haven't been able or willing to fix the issues. A case manager supports you to make sure you meet your obligations. We may use a combination of intervention, education and regulatory action. Heightened supervision is our highest level of intervention and supervision. We use it when you have long-term, severe or unresolved non-compliance. This is often because you have organisation-wide issues or poor conduct. At this supervision status, we monitor and engage with you often and intensely. We want to make sure you can quickly resolve risks to older people. A case manager works closely with you. They coordinate actions and are your main point of contact. We may also involve other stakeholders, such as the Department of Health, Disability and Ageing, to help resolve complex risks. We don't share your supervision status with the public and it isn't fixed. Your status can change at any time based on the current and possible risks in your service and how willing and able you are to manage them. This also means that you can move up and down more than one level at a time. We use 4 best practice principles to decide on the right supervision status. We want to make sure supervision is fair, targeted and supports you to deliver safe, high-quality care. Proportionate. This means our decisions are in proportion to the risks faced by older people. Providers who manage risks well need less supervision. Those with greater risks need more. The higher your supervision status, the more intensive our intervention is. Risk-based and intelligence-led decisions. We constantly check information about your service. We use reports, feedback and other data to spot risks and to act quickly when needed. Outcomes focused. We focus on real improvements that lead to better care for older people. Collaborative. We work across the Commission and with you to share expertise, resources and information so you can make lasting improvements. As a registered provider, you are responsible for meeting your obligations to deliver safe, quality aged care. As a regulator, our role is to find and respond to risk, to guide you and to act when we need to protect people in funded aged care. Here are some steps you can take to reduce risk, maintain trust and keep supervision at the right level. Support the rights of people in your care. Put older people's well-being first. Find and fix risks early before they get worse. Encourage staff to report their concerns. Show that you're managing risks well. Work with us to resolve concerns and strengthen care. Stay compliant so supervision is at the lowest level. To learn more about provider supervision and the Commission's regulatory approach, please visit the Commission's website. You can scan the QR code on screen or go to the link provided.